dear students. The title of today's lecture, The Main Syndromes of Respiratory Disease, Acute and Chronic Bronchitis, Asthma, Syndrome of Hyperinflation of the Lungs, Emphysema of the Lungs, and Chronic Obstructive Pulmonary Disease. Bronchitis. Bronchitis, inflammation of the mucous membrane leaving the bronchi. Depending on the caliber of the affected bronchi, produce acute bronchitis and acute bronchiolitis. Inflammation of the preferential small bronchus of the bronchial tree, the bronchioles. Acute bronchitis can be primary and secondary. Primary bronchitis develops as an independent disease. Inflammation starts in the bronchitis. On this picture, we see membranes of the bronchitis and complaint process in the bronchus in patients with bronchitis or bronchial asthma. Acute bronchitis is defined as a self-limiting lower respiratory tract infection. To distinguish this condition from common colds and other upper respiratory ailments, bronchitis refers specifically to infection causing inflammation in the bronchial airways. Various pneumonia denotes infection in the lungs, parenchyma resulting in consolidation of the affected segment or lobule. In this picture, you see heart process in the lung. On this picture, you see pathology process in the lungs in patient with chronic bronchitis. Acute bronchitis. The causes of acute bronchitis, depending on the research reasons that cause bronchitis, it can be infectious, virus, bacterial, fungal, and other. Bronchitis caused by the influence of physical and chemical factors, thermal and other. Allergic. Full bronchitis. Infection, allergic. Bronchitis noun or unspecific nature. The most common cause of acute bronchitis are viral pathogens of acute respiratory infection, influenza, parainfluenza, measles, whooping cough, measles, and other infection disease. Most bacterial infection, pneumococcus, staphylococcus, streptococcus, ear spilling, viral. The cause of acute bronchitis can be physical or chemical stimuli, including industrial hazard, dust, cold or hot dry air, derivatives of sulfur, chlorine, ammonia, and so on. And the bronchitis, mesobronchitis, the inflammatory process in the bronchi, which only covers the mucous membrane, and the bronchitis usually ends with full restoration of the structure. In severe disease, course of inflammation extends to the submucous and muscular layers of the bronchi, mesobronchitis, which leads to disruption of their function, deformation of the bronchial tree due to formation of scars. This criteria the condition for the transmission of aqueous inflammatory in the bronchus. Coughing. Coughing is the leading symptom of bronchitis. Cough is typically worse at night or with exercise, lasts more than 2 weeks in 50% and for weeks in 25% of patients, may be associated with bronchospasm and or excessive mucus production. Clinical signs of acute bronchitis. The disease begins with tickling sensation and pain in the chest, feeling of weakness, lethargy. For acute bronchitis, allergic disease typically connection with allergen exposure, presence of other allergy. Cough. Soon there is a painful dry cough after 1-3 days of beginning to move away, a slim of mucopurulent sputum, prolonged attacks of coughing, headache, and dizziness. The body temperature often remains normal. In some patients, it rises to subfebrile. Bronchiolitis. In the case of destruction of small bronchi becomes harder with the development of bronchial obstruction, respiratory dysfunction due to violation of bronchial patency. With bronchiolitis is swelling of the mucous membrane and mucosis violates the patency of the bronchial tree, develops shortness of breath and weakness is reinforces. On this picture, see X-ray patient with stage 3 of chronic bronchitis. Chronic bronchitis stage 1 differential from stage 3. You see pathological process in the endothelium epithelium in the bronchus. Chronic obstructive pulmonary disease, chronic bronchitis, causes long-term irritation of the bronchial mucosa of various harmful factors, smoking, inhalation of air contaminated with dust, smoke, oxides of carbon, sulfur, nitrogen, and other chemicals. Triggered by infection, viruses, bacteria, fungi, the negative role played pathology of the upper respiratory tract, there is a genetic predisposition that causes long-term irreversible destruction of large, medium, or small bronchi. Chronic obstructive pulmonary disease, chronic bronchitis manifestation start gradually in the morning cough with mucus expectoration release that is beginning to occur at night and during the day. In cold and wet weather, over year become permanent, sputum slime in periods of exacerbation, mucopurulent or purulent, there is progression and shortness of breath. The simple form of chronic bronchitis, the simple uncomplicated form of chronic bronchitis, purulent and purulent obstructive. For the latter characterized by persistence bridged by passing air through bronchial spasm and swelling of its mucosa. Lungs breathing hard, dry wheeziness. A syndrome increasing the islands of lung, percussion sound box. Bronchial asthma. Asthma is chronic inflammatory disease of the airways characterized by reverse variable bronchial hyperreactivity and bronchial tubes, hypersensitivity to different stimuli and annoyance. The major cellular elements of inflammation are eosinophils, mast cells, T lymphocytes, macrophages, and other. Bronchoobstructive syndrome, bronchial asthma due to bronchial smooth muscle spasm, swelling of mucosa, hyperreactivity, as specific and non-specific, is a basic universal thing of pathology, of pathophysiology, and asthma thus underlying airways instability. The main cause of asthma. By default, classic version of answer of the disease in the appearance of the first symptoms of the disease or in young children. Often this allergic atopic asthma option in these cases usually detected the presence of hereditary genetic predisposition, close relatives of patient with asthma, or the beginning of asthma preceded or other allergic disease, hay fever, allergic to pollen. Factors affecting the development and manifestation of asthma: internal factor, genetic, adiposity, flu. External factors: premise allergens, house dust mites, wool animals, dogs, cat, mice, and cockroach allergens, fungi. Out for allergens, pollen, and fungi. Infections: professional factors, smoking, tobacco, active and passive, air pollution inside and outside the premises, and food. On this picture you see other fruits and vegetables, which component of this may be allergens. The main manifestation of bronchial asthma: outdoor allergens, pollen, fungi, infection, professional factors, smoking, tobacco, active and passive, air pollution inside and outside the premises. Classification of bronchial asthma. The degree of severity of asthma is classified based on complex clinical and functional things of bronchial obstruction. The doctor evaluated the frequency, severity, and duration of attacks expiratory dyspnea, the patient's condition between the attacks, the degree of variability and reversibility, and functional disorder of bronchial obstruction, the response to treatment. Evaluation of functional parameter of determine the severity of the disease is carried out in the absence on episodic expiratory dyspnea. According to this classification is determined by the patient's condition, severity of asthma, yes, allocated, intermediate episodic course, persistent, permanent course, easy, medium, heavy, and heavy. Functional diagnosis. For the diagnosis of asthma, applied research is lung function spirometry, while the focus turns to the indicator characterization, the speed of air through the bronchi during exhalation. Research carried out on the machine with the computer processing of the results and their correlation with normal value relevant gender, height, and age. Functional diagnostic prolonged if you suspected asthma, also performed a test of the drug to identify bronchospasm. Increased speed performance by more than 12% of an argument confirming the diagnosis. In addition, the system for diagnosis of the disease is the definition of total immunoglobulin E as a marker of immune allergic body in the detecting specific antibody by skin test in laboratory or by using special panels. Functional diagnosis. For the diagnostic of asthma, applied research in lung function spirometry, while the focus turned to the indicator characterizing the speed of air through the bronchi during exhalation. Research carried out on the machine with the computer processing of the results and their correlation with normal value relevant gender, height, and age. If you suspend asthma, also performed a test of the drug to identify bronchospasm, increasing speed performance by more than 12% of an argument confirms the diagnosis. In addition, the system for diagnosis of the disease is the definition of total immunoglobulin E as a marker to immune allergic body and detecting specific antibody by skin test in laboratory or by using special panels. This is repeat information. The easiest method for diagnostic bronchial patency is the peak flow meter, determines the maximum air velocity in the force vids, and patient is offered for 1-2 week to time daily peak flow meter contact and record data in diary. The doctor at the reception country variability parameters. Bronchospasmodic syndrome, emphysematous barrel chest, and functional indicators external breathings. Thank you for your attention. I wait from your question on my email.